evening and welcome to the Commonwealth Club World Affairs. We're glad you're here and welcome those joining us online. My name is Lila LaHood. I'm Executive Director of the San Francisco Public Press, and I'm here to moderate a fireside chat with a distinguished panel of experts. We're here to address a timely and critical issue, made all the more so by recent announcements of budget cuts affecting healthcare organizations nationwide and here in California. It's time to strengthen local health ecosystems in California. This event is being video and audio recorded and will be available for watching and listening later. We'll have a Q&A session following our dialogue. Audience members can pass along their questions to club reps. Please turn off your cell phones. So as I said, we're here to talk about trends in healthcare in San Francisco and the Bay Area and look broadly at what we might describe as our local healthcare ecosystem or our healthcare and also our healthcare safety net and what could be done to make it stronger. To put things in perspective, when we think about how people access healthcare, it might be through major institutions, hospitals, medical centers, through public health centers or ones run by nonprofits, through doctors and private practices, through community clinics that are run by nonprofits and sometimes supported by volunteers. This doesn't even get into the role of first responders and EMTs. And of course, there's a lot of crossover, and some of what we'll discuss will apply to more than one part of the system. Today, we will give extra attention to the end of the healthcare spectrum that often serves lower income populations and people who may be uninsured or face other challenges accessing traditional healthcare options. We're also going to talk about environmental sustainability and efficiency. How can communities use the resources they have responsibly to help as many people as possible? One caveat, when I was talking about this conversation this evening with some people I know, one immediately brought up what a hard time she and her partner were having scheduling appointments with specialists. And another, who happens to be a specialist, brought up how much pressure doctors are under to do more with less support and to shorten patient visits. We're not really going to get into those kinds of topics today because there's already so much to discuss in terms of the healthcare safety net, and that's where we're going to focus our attention. So I think that's enough of a preamble. Let me introduce our panelists. First, we have at the far end Isabel Navarrete, who is a sustainability analyst at UCSF Health. Isabel oversees the organization's municipal waste program and has led successful diversion initiatives, including launching a blue-wrapped recycling program, expanding medical donation efforts, and enhancing the collection of reprocessed materials. Caitlin McKeegan-Jackson is the new McKeegan-Jackson is the new executive director of Clinic of the Bay, a free volunteer-powered health clinic working with the medically underserved in the San Francisco Bay Area. She brings over a decade of nonprofit leadership across healthcare, education, and faith-based organizations. Jiwan Min is the Chief Technology Officer at Every.org, a nonprofit platform that allows all nonprofits to accept all donations. Jiwan previously served as an engineering lead at a supply chain technology company focused on humanitarian aid logistics. And we have Eric Talbert, CEO and co-founder of MedCycle Network. Eric has worked with hundreds of organizations globally and locally to increase access to health and to protect our planet by addressing old problems in new ways that often involve new technology. So the first thing I think we should talk about is the stress factors affecting our healthcare system right now. Some are caused by policy decisions, cuts to Medicare, Medicaid. We've talked about extreme weather, and other issues that might be surfacing because of demographic shifts. I'd love everyone to answer this question. Of all these factors, which ones concern you the most and why? Who'd like to go first?
I can start.
Great.
So I work in sustainability. So any climate change events, we know that climate change makes these events more extreme, more common. So from a personal standpoint, I think that's what concerns me the most. But also from a political standpoint, and just like the climate where we're at, the funding cuts have definitely affected some of the work that we're doing. For example, we usually have an AmeriCorps fellow that's with us doing some of the work. The AmeriCorps program got cut in April. As a result, we lost a team member, some projects on our hold. So it's just a little challenging to deal with some of those things from my perspective.
Caitlin, how about you? And I know you're in a new role, but which of these factors are of greatest concern to you?
Yeah, I think the biggest one we're seeing at the clinic now is the fear from folks who are undocumented immigrants, and even immigrants who are documented are having the hardest time. They are afraid that their records will be accessed if they apply for Medi-Cal. They're afraid that they will be interrogated when they come to our clinic or to the clinics around us. And so we're really finding that that fear and anxiety it causes not only health problems, mental health problems, but access issues. And so we really want to create that safety net where they feel safe. And it's hard to do when there are so many larger scale changes that are working against them.
And Jiwon, what's your perspective on this?
I definitely want to echo the shifting tides, not just the funding cuts, but how that affects everybody down the line. So if the federal funding cuts, for example, are affecting large organizations, then even grant makers are shifting their strategy to help different initiatives, and that's really affecting downstream the smallest organizations the most. And so when I'm looking at a macro fundraising level, because I do have the lens of thousands of organizations, it really is stressing everybody out, but it affects the smallest organizations the most at the moment.
And Eric, biggest concern in your mind? I mean, there's so many.
There's so many, and so for me, the biggest concern is all of them, right? The polycrisis in which we find ourselves. But I'm also very confident in knowing these kind of folks, the response that's needed, right? And it's coming together as community, doing more collaboration. So what I say from our perspective at MedCycle Network, the greatest threat is the significant increase that we're seeing through our partners and our colleagues and folks that are unable to access their basic human right, which is dignified healthcare. And so knowing that that's already an existing problem, we're anticipating that to grow exponentially. We are trying to, and building new technology, but also building new partnerships to be able to get out in front of that. So when folks do show up at Clinic by the Bay, they can say yes more often to more folks because we've got the supplies donated from UCSF. We've built the technology to get it there quicker, to be able to support the existing health ecosystem. So what are our opportunities to connect those dots, support each other, knowing what's coming, and also centering the communities that we all know and love, who are often the most vulnerable and the first who are already experiencing this and are bracing for additional impact.
So you brought up one thing that we definitely want to talk about this evening, which is partnership and working together. Before we get into those questions, though, I'd love for Caitlin, if you could talk a little bit more about the role of community clinics. And can you talk a little bit about what your goals are in terms of preventative care or responsive care? How do you approach this, and what do you find that the community is looking for most?
Yeah, so we are primarily, we're a free clinic. We're part of a network of free clinics. And the folks who come to us have chronic health issues typically, and we're trying to keep them out of the emergency rooms, out of urgent care, out of an ambulance, because those things are all so scary. So we are really trying to get them to manage their diabetes, manage those other chronic conditions, and work together with specialists and other providers so that we can get them referrals out for more free care. Because the people we see are uninsured, we really work on those other partners to get them more interventions and more screenings or surgeries if needed. I think something that we are seeing that our clinic can't help with is we have people who come in and want care right then, and they'll come after hours when our clinic is closed, and we have volunteer providers who are phenomenal, and also they cannot be there 24/7. And so how can we increase our capacity, which we are doing? We're adding a third day based on patient requests, and that's really exciting for us. But to just feel like personally the need is unlimited, and I have this set amount of resources, and I will do my best with what I have. But gosh, the need is far beyond what we can fix.
I know you also you work a lot with volunteers. Can you talk a little bit about the role of volunteers at Clinic by the Bay?
Volunteers are phenomenal. I love them. Shout out to, we have an intern, Gideon, who is here with us. He and his other cohort of folks, I do not have to pay people to do our graphic design, to care for patients, to room patients, to give them food on the weekend, because there are volunteers who just show up and who get that sense of community and love coming. And that means that on the fundraising focus, gosh, our budget is so modest compared to everything we can provide, because people show up with a smile on their face and they're happy to be there, which I think is just, it's squeeze. Sorry, I know I'm still in the honeymoon phase. I've only been there for a month. But really, they just want to be there, and they want to hang out with us, and they want to hang out with the people in Excelsior. And what like a phenomenal world to find, like, the world is hard, and also people show up for each other, for their neighbors, and they are happy to show up. And that is the biggest joy.
I love your responses on this. The audience does too. Isabel, you're at the largest organization here. I think it'd be helpful for us to hear about what UCSF is doing internally in terms of sustainability, but also about how the organization is part of the larger ecosystem and how it works with other organizations in the community. Could you talk a little bit about that?
Yeah, so I mentioned we're a pretty small team. My coworker Michaela's right over here. There's a group of about 4 of us. So internally, we do a lot with a small team. So we do a lot of like the waste, the energy procurement. We do have partners that help with like clinical sustainability or energy manager that we work with. But one of the things that we did recently was actually published a climate resiliency toolkit. And that essentially acts like a blueprint for other health centers to also become resilient themselves. It has things like an org chart, so you can know like maybe what departments should be considered when making these conversations, maybe like a checklist of what to do before, during, and after a hazard event. And it's basically there to allow us to almost like triage climate change events the same way that we would maybe like an earthquake or a tsunami. We just got a tsunami drill a few days ago. There's a protocol for that. We need to make sure we have protocols in place for climate change events. So that's something that we're doing as an organization. But in terms of going back to the community, we're actually working with MedCycle and a group called ARC, Anchors in Resilient Communities, to help community-based organizations or CBOs become climate resilience hubs themselves via, giving them supplies, giving them the tools and resources they need so that they can support local communities. You mentioned people don't really go to hospitals or ambulances when stuff like this happens because they're scary. So we're trying to make sure that local community groups have those resources to become those safe spaces, because inevitably when stuff bad happens, people are going to want to go to a safe space, maybe not a large, scary institution, for UCSF.
Yeah. I have to say, you're all handing me these segues because I wanted to go from what you were talking about to Eric and MedCycle's role in all of this, and how are you a link between a place like UCSF and Clinic by the Bay and other smaller organizations that might need physical resources to provide the healthcare to the community.
Yeah, so we rely on our partnerships. So MedCycle Network, our focus is to collect high quality surplus medical supplies, like from UCSF, inventory them, and then through our technology, be able to distribute them to organizations like Clinic by the Bay. So they always have the resources. So they get the amazing volunteers to show up. They got folks in the community who have found that courage, came to look for some care. Our role is mostly behind the scenes to make sure that they have the equipment and the supplies that they need and don't have to worry about that. So they can focus on their mission, and the volunteers show up, they feel supported, and most importantly, when the patients and community members show up, they receive the care that they need because they have the supplies. And so our goal, part of our goal is to be a convener in building bridges between where there's surplus and be able to transform that into health access. Because otherwise, a lot of this would be going into the landfill. So we have that sustainability lens. I love that Isabel and the team made a handbook, big fan of those, to be able to share how we can do that. And then incorporating ways to do that faster with more, less resources but more impact by building the technology to be able to make the matches sooner, meet the needs list, the wish list, and a lot of behind the scenes supply chain and inventory, the right thing in the right amount, in the right quantity, at the right place, at the right time.
When are these items deemed surplus? Like, how do they become surplus items?
Yeah, so there's a few ways. Some of it is just kind of a typical supply chain. I think we've all experienced. We ordered something, comes in the wrong size, the wrong color, the wrong shape, just the completely wrong thing. And there's not a reverse logistics for it. Like you just, right?
You don't send it back.
You
to
don't send it
Amazon.
back. Hopefully you recycle it. So that happens the same in health systems and healthcare. And so being able to identify that, and then there's oftentimes changeovers just for different reasons, different improvements, different contracts. And so the surplus then is innate within the system. And so we build the team and the technology and the partnerships to be able to repurpose that, because those are still high quality goods that we want remain local. So we're also minimizing the amount of carbon we use to transport that. But it's going and staying within our community, because these are the people who we love and care for and want to make sure that they have access to the healthcare that they need through these organizations. And so it's really being that kind of additional partner where we can pool all of these resources. So we're not putting more burden on a clinic by the Bay, San Francisco Free Clinic, to then individually go to UCSF, other hospitals, and say, hey, do you have these three things? We step in and say, you focus on your mission, let us collect, organize, and then you can come and select exactly what you want from us, and then we will deliver it.
Thank you. That's helpful, because I think sometimes we imagine all of these things, but how is this? How does the system work? Juwon, how can we use technology to address some of these challenges, either ones that have specifically been mentioned or maybe ones that you're thinking about because of other experiences with healthcare locally?
For sure. For full transparency, I'm also kind of new to my role, but I think technology, I've been a technologist my entire career, and I think it's one of those things where everyone puts all of their hopes and dreams into it, and at the same time, I still, after all these years, believe in its power to both provide resources and like democratize a lot of the things that are inaccessible to people. So for example, the organization I work at, every.org, it is made for everybody to come and fundraise. MedCycle Network signed up. Thank you, Eric. But also, especially for small organizations who provide for the community, we're not actually selling anything to anyone. And that's part of what we just wanted to provide the technology for them to accept any sort of method payment. And that's accessible because of the technology that we built that doesn't need people to scale. So a small organization might not have the funds to hire a grant writer, for example, or have someone to be there to process stock donations and crypto donations, but they do it through our technology for free. And so that's just one example, and it just happens to be where I work at, but I do believe in technology making it super accessible for especially the organizations who do not have the resources to do the larger things as some of the larger, the name brand nonprofit organizations that we know of.
Let's talk a little bit more about funding cuts, and I'd love to hear how these are affecting each of your organizations and maybe what the response has been. And if we can talk about filling the gaps, how do you reach out to donors, and how do you do that when you might have to do it again and again and realize that there's not a limitless supply of funding to make up for what might be lost in terms of government funding?
So I mentioned that our team had some layoffs. There's some projects that are on hold. What we try to do is rely a lot on local support. There's still a lot of local funding and state grants that we have been applying for. I can't speak on behalf of UCSF. I'm sure there's budget cuts happening for the organization, but from my department, we primarily rely on grants from the city of San Francisco and the state of California. So that's kind of how we're bridging the gap to get some funding for some of the programs that we still want to launch.
And I think we're in a really good spot because we're volunteer run and our budget is fairly modest. So, but we had this conversation in the Waymo on the way, that for how long can you go back to the same funders, and we know that those opportunities may dry out. So where are we turning to next? And realizing that the people we turn to next are also being turned to by everyone, by PBS even, which we love PBS. And so how can we something I appreciated that Eric said on a call a week ago was to have this perspective that we can make the pie bigger, that we can come from abundance and not from lack. And so that has really changed how I'm viewing this world, to say there are cuts, and I will commit to a perspective of abundance, even if it feels overwhelming.
I like that. And I know, Jiwan, you had talked about maybe helping organizations find alternative revenue streams. And can you talk a little bit about that and maybe
sure.
approaches you've taken?
Yeah, I have some stories because I haven't been here too long. There was an organization who got affected by the USAID funding cuts. They were a humanitarian aid organization. They, in a strategy shift, were hoping to start accepting crypto donations, and we got them up and running within 2 hours on the platform, and they were able to fundraise seamlessly. But all to say, it's as people are looking to alternative sources, it isn't hopefully this zero-sum game, as you mentioned it on the call, and looking at it from a lens of abundance, as Eric said so elegantly. We're trying to make sure that it's basically stupid easy for anyone to give, right? So it can be, and most of our donations come from everyday people, right? You might think like, oh, high net worth donors are giving all these crypto donations, which they are, by the way, so you should sign up for your organization. But it really is like these small everyday donors that are supporting these large budgets that are making the biggest difference in these strategy shifts. And without, our mission is not to have more organizations compete for the same funds, it's to increase giving in general. I think it's only gone down since, I believe, the year 2000. And so we try to get that up from 2% giving, 2% of income giving, to our goal is 3%, which is obviously we're not going to do that alone, but that's coming from the mindset of abundance.
And Eric, what has MedCycle's approach been in terms of funding either your organization or helping others get the funding they need?
Yeah, absolutely. I think so. Part of it is looking for. So earlier, I said my main concern is the poly crisis, right? So what I'm looking for is poly solutions, right? Like every.org, one stop. They've got it all worked out, clear and easy. Right? It has exponential impact for an organization like MedCycle Network and others. Same with UCSF and Clinic by the Bay. They're doing multiple things in multiple ways to increase sustainability, increase access to care. So where are folks coming together, working together to create new solutions or improve the solutions they already have? Because I think part of the moment, that historical moment that we're in, that I'm thinking about and feeling, and we talk about MedCycle Network, is collaboration is no longer an option. It's essential. So can we show up as our best selves, be vulnerable, and be generous, and find ways to not only fulfill our mission, but how can we provide exponential impact and through partnerships, through collaborations, so that way we are building our strengths within our community, but also strengthening those relationships with our donors to help them feel a part of the success. Because giving also feels good. Mm-hmm. Right? For those of us who are lucky enough, privileged enough to donate, and when we do, there's a reciprocity to it. We feel good. We want to support the mission. We tell our friends and family about it, the impact that we have, and want to be able to tell those stories. And so the easier we can make it for folks to see the impact that organizations are making, and then be able to share those stories and be in authentic, honest relationships with the challenges as well as the successes. I think more of us coming together, especially in this moment going forward, the stronger we will be. Because the health systems, the local health systems, they need, especially the safety net systems, they need more of us finding ways to collaborate and working together to solve old problems in new ways.
Do any of you have, we're talking about partnerships. Any of you have stories of new partnerships that you've entered into recently, or just a successful one that you'd like to highlight that we haven't talked about already?
Well, I have one, but it's really, we're in the pilot stages. So
well, tell us a little bit if you can.
So I mentioned ARC, the Anchors in Community Resilience. So there's a pilot program to help 2 CBOs become climate hubs. One of them is actually the Women's Building.
Tell us what a CBO is.
Community-based organization.
Thank you.
CBOs for short. So one of them is actually the Women's Building in San Francisco. So like I mentioned before, we're just trying to leverage our connections with MedCycle, ensure they're getting supplies they need, resources they need to become climate resilience hubs for their community.
Can you talk a little bit more about what climate resilience means and why we need to be thinking about that as a community level? Are we talking about like heat waves, about wildfires? Talk a little more about
Yeah, so both of those events. So climate resilience, in short, just means that the organization or institution or a group is able to anticipate these events. So we have like fire season, we have like flooding season. So long as the org can anticipate the events, have the resources they need to write it out, support whoever needs to support, and then recover quickly. That in itself is like building resilience. So like a super easy way to start building resilience is like just build community, whatever that may look like. It could be meeting your neighbors so that in the event of like wildfire smoke, you have your first line of defense that you can go and see if they have maybe extra masks or extra air filtration systems in the event of a power outage. Maybe they have a power bank they can lend you. So that in itself is a really small way to build resilience. And then you can tee that up to start working with the CBOs or large institutions like UCSF.
I love that you gave that example because when we were talking last week, there was a lot of energy here in talking about healthcare, not as just an isolated thing, but there's a lot of interconnectedness with our healthcare system, and it's connected to education and the environment and the sense of community. Can Caitlin, could you talk a little bit about that sort of sense of community and what the clinic is doing to try to reinforce it?
Yeah. My dream and what I see us doing now is at the fanciest high-end hotels, you come in and they know who you are. They already have planned out where you've been. They know what you care about. And my dream is that one day the St. Regis will tell us all of their things so that when a patient comes in, it's happening on a small scale now and we're building it out. We know Alma's dog's name. We know her husband's name. We love her dog, and we sent Christmas dog treats. And like that level of care for the people in our community, and then empowering Alma to say, Alma, who are your people who are also uninsured? Can we be their medical home? And we would love to be their home. Bring them. And so sometimes that means like we had someone walk in who needed a vaccine and we were able to get her seen the next day. And we just really invited her to consider us her home. And I actually have my son was at UCSF for a week. And what they did was they made a community and they made him feel like he was at home, and they made us as his parents feel like they were sitting around the couch with us. And so I think that level of person-centered care, where it's not only about the patient, it's also about who we are as people when we are volunteering, being physicians, showing up. We bring who we are and who they are, and that is like the beauty of community. I think that is just what a phenomenal dream to have, and also to care for them and to make them healthier.
I love that. I love that. And Eric, we're talking about sort of that local sense of community and resilience, but I know with MedCycle Network, you work locally, but also internationally. How is this all interconnected, and how does what's happening internationally perhaps affect things here and vice versa?
Yeah, absolutely. So I think as I hear from the panelists, like the world is becoming more interdependent, right? So how can we be more intersupportive? And so for us, our focus is partnering with local hospitals to support local clinics, but that doesn't mean we're inflexible. So for example, right now we still know a lot of civilians in Ukraine need access to healthcare. Well, luckily there's a group in San Jose that's been doing that for 10 years, has a close relationship with the Ministry of Health. They know exactly what they want. So we're able to just send it a little bit south, they compile it with everything else to be able to go and treat those civilians. So it's being open to the possibility of what the needs are so that we also don't fall into the process of allowing the supplies that we've collected expire or become low quality. So we're constantly looking for opportunities to remain flexible while still focused here on the Bay Area. We're looking to expand to Southern California, build out our statewide hub, Because anywhere there's hospitals and there's clinics, there's this need for this opportunity to repurpose these surplus supplies so that the first pass and the bulk of them stay in the community. But there's also surgical supplies that a lot of these clinics don't need or don't need at scale. So we have the nurses, the physicians, the surgeons who work at those hospitals and clinics or volunteer at the clinics, who also can take them in their suitcases with them when they go to Tanzania or when they go to the Philippines. We also want to support that work because we know that's how they share their love and they take their practice and their skill and they extend it out. And so when they come home, they're that much more invested in and informed within their own community of what else they can do here. So it's thinking through and being open to the poly solution I mentioned earlier of where's the best fit, how do we get the supplies distributed into the hands of people who are providing that care so that they can focus on their skill and not worry about the supplies and not worry is it going to be enough or can I only do that surgery with one glove, right? It'd be like, yes, bring in your friends, bring in your neighbors. We've got plenty of pulse oximeters, right, glucometers, right? Get it out so that people are able to fill in their power to take care of themselves, take care of their friends, and be in community with the clinics and the hospitals as part of that local health ecosystem.
And knowing nothing is getting wasted.
Nothing's getting wasted.
Yeah.
And no one's getting forgotten or overlooked or allowed to fall through the cracks.
Juan, I wanted to ask you, we talked a little bit about, everyone's talking about AI these days. And, is it scary? Is it the solution to everything? What are the practical ways that you think AI might actually be able to help with some of the things we're talking about today and the safety net?
Totally. It's hyper relevant because we have the CEO and co-founder here. Eric and team are a perfect example of an organization who uses AI in a thoughtful, ethical, and actually useful way, right? It is a buzzword and everyone's like, how can I get my hands on it? And at the same time, when I had a discussion with Eric about his technology, he didn't do it just because he wanted to. He did it because he knew that it was going to help the efficiency of his organization to do exactly what he just said. So to repeat his words, it wouldn't forget about someone. It would automate some of the things. For example, one of the things we've discussed AI could do is start recommending things to Clinic by the Bay so they don't have to spend their time going through the list of like, okay, we need to order more of these from MedCycle Network, for example. Imagine if the AI was like, hey, you used these last year, would you like some more? There's supply. Things that are very smart, thoughtful, still ethical. I've never seen co-founder, at least in these parts, say like, is this going to be HIPAA compliant? Not a lot of people are thinking about compliance and making sure it's person-centered. And yet here, Eric and team are like a perfect example of how AI can be great in this use case.
These are great examples and great stories. We framed this discussion as about strengthening local health ecosystems in California. If we look at things that are happening here in California, are there things that you might describe as cutting edge or, I don't know, are there things that are being done here that you say that you can identify and say others are going to be doing this soon, or if they're not, they should be following our lead on this? Are there things that are going well? And maybe conversely, are there things that aren't going well here that you think perhaps we should be looking elsewhere for better models? Maybe that's too big.
Well, I'll jump in. No, that's great. I will jump in and say the handbook.
Okay,
Isabel
tell me
mentioned
more.
earlier
Yeah.
around the sustainability, right? So if we can take that model, and this is our approach at MedCycle Network as well, is to document what we're doing, build an open source technology, and share that so it can be replicated. We don't want to have to do this in every state. We want others to have the information, to have the playbook, have the technology, and step into their power, into their community to solve this problem in the way that they want to, in the way that they know how it's going to be sustainable, because it protects the environment and it strengthens the health within their communities. So being mindful of what you're building and how can that be replicated or just be shared so other folks can replicate it. And back to the mindset around abundance and community and creativity, is like, let's not try to own these solutions. Like, we need these to be replicated. Like we need to sound the alarm without sounding alarming. Like, our healthcare safety net is in crisis in this state, in the city, and in this country. And the more we can do for others and share and these resources and build ethical technology, the more we're going to be better prepared to respond, because we already know what communities are going to feel the impact. The question to us is, what are we going to do about it? So that way we can work together. And to your point, or to your question around is, so how do we do that different, right? And I think it's for us, it's transforming and being able to commit that through our shared values of health equity, that we turn that into action, and that we commit to that action, and we take on the complexities and the hard problems so that organizations can focus on their mission and at the same time support the environment. So if we're increasing, again, hopefully a poly solution, increasing access to care, protecting our environment, and empowering communities to work together, to collaborate, get to know each other, be able to rely on each other through the resilience, not just in times of crisis, but just to build community, then we will get through this together. It's going to be really hard, but more people will survive, because the amount of uninsured people is going to continue to skyrocket. And that's something that we need to be able to continue to find different ways to take the existing resources and connect the dots to be able to solve that problem as best as we can in new ways.
Isabel, could you talk a little bit about the handbook and maybe give us some examples that other communities might not, or might be able to take and implement quickly, that you think would be particularly effective?
Yeah. So, for example, I mentioned there's like a checklist of what to do before, during, and after events. And then there's also like an org sheet that just has a list of people that maybe should be involved in these conversations. So the hope is that other med centers can take a look at that checklist and kind of do an audit of things that they are already doing, and kind of find the delta and see like, how can we strengthen our program? Or, I didn't consider that maybe we should look at X, Y, and Z. Maybe we have a committee that's formed to review this handbook and see how we can improve like their own resiliency.
I like that. So they may be doing some of these things intuitively already, following it, but with a little bit of guidance, they might, you might help them identify additional opportunities. Okay. Actually, that sort of gets to my next question. I was going to ask on what are you working on that has potential to scale? That sort of already responds to that. Does anyone else have other examples of things that they're working on that you think, boy, this would be something that would be very easy to share with, the clinic in the next community, or, this could be taken to another state and adopted by an organization that maybe also has limited resources?
I think for us, the way that we're using AI, we have built like a custom chatbot, which is not cool. My mom would be impressed, but that's about it. So we built a custom chatbot that has all of our grant materials and all of what we're doing, everything that we've applied with, and the specific language that we're using, so that then we can rely on interns or volunteers to go in and say, you can ask this custom GPT to fill out this grant question, and then we need to look at it. But I think in many ways, I came from rural California, and even the concept of AI or being able to talk to AI is not as common outside of these big areas. So being able to go to the next clinic and say, no, really, like you can make your own, and then you put the document. So I think that would be fantastic.
Caitlin, what about your volunteering sharing? You mentioned that the other day to me.
We are. Yes. Oh, okay.
That's a good one.
Volunteering, sharing. So I come from the Methodist headquarters, and so I got connected with a food pantry. They are short on humans, so they have enough food to distribute to neighbors, and they distribute it to people who also have insurance, so it's regardless of your insurance status, but they're short on human beings to show up. And something from that group of people is that they're typically older, and they're really like the progressive mainline Protestant churches are falling away on humans. At the clinic, we have so many humans. We have humans busting out of our ears who just, for some reason, want to hang out with us. And so we're going to send some of our humans to their food pantry distribution, so that then we can get them through the line more quickly. And I have a secret hope that we'll get their diabetic folks and then bring their diabetic folks to us, or bring our diabetic experts over to them, and so we can kind of cross pollinate. So yeah, the sharing model would be super fun. Although I'm assuming someone else has thought of that, which is why I didn't highlight it.
I love it. Actually, it's not something you hear about very often, and I'm glad you brought that up.
Yeah.
Yeah, here's another. So you're working with this organization already. Do any of you have dreams of collaborating with, either a specific organization or type of organization or types of community members that you're not already working with? Who, if you could give a shout out, we're looking for, or we'd love to partner with, who or what would that be?
Yeah, I see them thinking, so I'm going to jump in.
Okay, jump in, please.
So for us, for MedCycle Network, we would love to be more connected with the Native American population and the communities and the community clinics. We have some connections through some one-offs, but looking, and we know they're very well organized at the federal level, but within California, right, that's a community that we want to center, we want to support, and want to collaborate and build deeper partnerships with, so that they are not... so they have access to these supplies, because when we collect them, right, our goal is to be able to distribute based on what they need. In addition to help them save time, it's saving them cost. And so those are partnerships we want to focus on. We would love to know and to connect and build more of that throughout the state.
That's a good one. Does anyone else have ones they would mention or calls out to the community?
Shout out to MedCycle, who connected us already with Mission Neighborhood Health today. Hi. So we already got connected, and we are applying to be part of the San Francisco Community Clinic Consortium. And so just send out all of your good vibes that they will let us be. Even a junior member would be so phenomenal. So that's my hope and dream.
I love it. Any others? Or... I've got a bunch of questions. I'm gonna throw one more question to the group, and then I'm gonna get to the community questions. What if people who are listening, either here in person or listening remotely, what if they want to do something to help? What are your recommendations for individuals who want to help strengthen our local healthcare ecosystem? What would you recommend that they do?
I'll start.
Okay.
See them thinking. So if you have the privilege of the funds and the resources, donate it. I was speaking at Wall Street last year and was being told by these very wealthy folks how they were so bold, right? And fortune favors the bold. I said, fantastic. Be bold with your fortune. Support these organizations. Support UCSF. Support Clinic by the Bay. If you're not, go on every.org. Start a fundraiser. Because there is a lot of value and a lot of opportunity to increase your own sense of joy and connection and community by inviting others to support a mission and organization that's in your community or that you're passionate about. And know that you're inviting them, you're giving them an opportunity to feel good. So if you have the funds, donate them. What's more valuable than funds, we can all raise more money, is your time. It's an unrenewable resource, so please donate your time, volunteer. Find an organization, any organization up here, one close to you, one your family's connected with, one you find out online, and donate your time. And just remain curious and humble. Right? You mentioned, okay, what can others learn about California, San Francisco? As someone who's not from here but lucky enough to live here, right? I'm in awe of the history of California, the environmental movement here in San Francisco, the public health response to the HIV/AIDS crisis 40 years ago, Healthy SF 20 years ago. These are trend-setting opportunities that other cities and states have followed. At the same time, we need to remain our humility and learn from other states and other organizations, and particularly rural areas, of what are they doing, how are they solving these problems, how are they coming together, and what can we learn from them and exchange and be appreciative of that type of diversity.
I like that. Joanne, what's your call to action?
Eric took all of them. But no, I would say, so the awareness piece is really good. We talked about it in our conversation last week, that it is so hard to stay aware because of everything that's going on, and a lot of people are burned out from just reading the news. But if you follow your favorite nonprofit organizations, I promise you that'll be the best part of your day, because they're doing such amazing work that it'll keep the awareness on on a more hopeful level. And I think that's your awareness then turns into action, which might turn into donations if you're privileged enough, that's fine. But truly the awareness is mutually beneficial to the organization and to yourself. So that's my call to action.
Caitlin, how about you?
We would love more volunteers. We really have a lot of fun. We especially need dentist volunteers. So if you go to your dentist and you're best friends with your dentist, who is best friends with their dentist? You could. I'm so sorry, ladies. We have our Mission Neighborhood dental ladies here, and you are my best friend dentist. Okay, so bring your dentist to Clinic by the Bay. That would be so helpful. We will absolutely take your $7. That would be fantastic too. Follow us on social media. Maybe we'll make billions on TikTok from being TikTok famous. So follow us on social media. And I think just care. Just care about the people next to you and around you, and just care.
Yeah.
Isabel, what would you
Going off on care, I would say going back to building resilience, we need to start building resilience within ourselves. You don't have to rely on a large institution to be there for you. You can make that safe space yourself. So I think my call to action, like, get to know your neighbors, make a group chat, make a community group, so that when something inevitably happens, you have someone that can check up on you. You can check up on them. It feels really good to care about individuals. So simple call to action, get to know your neighbors, get their numbers. Next time there's a flood, check in on them, send them a text. Do you need something? I have these things. You know, it's about giving and sharing. There's like this phrase that everybody wants a village, but nobody wants to be a villager. So I think it's time to become villagers ourselves.
I like that. That's such a great image. So I've got some questions here. One of them I think we already answered because it said, which of your organizations require volunteer or financial help? I think we answered that question. And yes, you can approach them after the event. Here's one that I thought was interesting. In terms of preventative care and sustaining someone's general health, how much have you seen yoga or meditation as a resource, especially when made accessible as a body, breath, mind, spirit practice?
I feel like that's when probably I should answer.
Yes.
And I'm looking at my colleague Olga, and Olga, I invite you to comment back on what you think I'm going to say. My wife is Mexican and Native American, and I really think that for us, yes, yoga and meditation are valuable from a clinical sense. We know that's true, and also from a Mexican and Native American heritage, it's not called yoga and meditation. And so how can we bring in those aspects of meditation when we are doing, maybe we're doing the rosary and we are bringing that in a culturally appropriate way? How can we as healthcare providers bring that in, but in a way that is true to who they are? And if we want to bring in more yoga or movement with breath, how are we taking that into something that's already built in their culture? How can we celebrate dance in a way that is movement with breath and also have it be tied to their health? I think that's how I would love to see us frame it. Olgasita, what do you think? Is that fair? Okay, yeah, thank you.
I love this idea of like culturally responsive and culturally engaging healthcare options.
Yes.
I feel like there could be a whole panel on that.
There could be. And my wife was always like, why are you going to that white lady yoga? And I'm like, because it's actually not from white ladies. Okay, it was really not from America, but okay, yeah. So she will never go to a yoga class, but there's more ways to get her into that kind of stuff.
I love it.
Yeah.
For future discussion.
Yeah.
So here's an interesting one, and I don't have an answer. I love new ideas like this. What would it take to create sustainable funding? Is there any consideration of building a way for people to check a box on their taxes to support resilience in communities? Does anybody know about anything like this or how to make it happen?
Yeah, I don't know how to make it happen, but I will say, love these opportunities, ideas of how to do more collective action through funding, right? And so what comes to mind for me listening to that is thinking about, right, what are there's like the tax-based legal opportunities for tax deductions for donating, financial but and there's the challenges coming up to that, and there's changes. So please be aware of that, especially if you are one of those high net worth individuals with a donor advised fund. But I think it's also finding ways to make a commitment to your own well-being, your self-care through community care by making a commitment as a family, whatever you can afford, a percentage, right earlier from 2% to 3% of GDP. That'd be amazing. Can we do that as individuals, as family, as community members? Can I offer, the extra lemons from the community garden to my neighbor 3 times a year instead of 1? Right? Like, what's that next level of opportunity and engagement? And then from the specific funding side of that, I think there's a lot of opportunity to organize some legislation from the city, county of San Francisco, and then through the state of California, which would be an innovative model that hopefully other states and other cities and counties would want to replicate, with the understanding that as citizens we have commonwealth, right? And we want to share that and make sure the folks in our communities who can get increased access to that through those funds.
That's great. Anybody else have any thoughts on that, or
It triggered an idea that
tell us?
you can get your license plate to be cool. And when your license plate is cool, it donates to someone. And so I wonder if there's an opportunity for healthcare to have our own kind of license plate, because that's one way where you do it every year, and what a hassle it would be to unenroll from that. So maybe that's
You'd have to find a screwdriver.
Yeah, you truly would. So
I love it. I love it. This is a great question, and and this would be a great thing for maybe for those who want to know here or to be able to share this information. Please tell us more about free medical care and prescriptions here in San Francisco. If somebody was asking about these, what resources would you point them to?
we're happy to take everyone that we can. There's also the San Francisco Free Clinic, which is east of the Haight-Ashbury. Okay. And then all of our cool friends, NEMS, the Mission Neighborhood Health Center, there's so many of them that do a sliding scale. Mm-hmm. So they do a sliding scale based on your income level. So there really are those resources available. We will absolutely take you for free. And Healthy San Francisco is another option where you pay a small amount, again, sliding scale, and you have access to prescriptions. So that's really cool too.
I love it. Does any other resources to share or to point people to?
I would do SF Free Clinic, and I would be my counterpart right here.
There we go.
I would just add to that, to Caitlin's comment, to be open to and be aware there's probably a clinic closer to you than you think, mm-hmm. and to check with the San Francisco Consortium of community clinics. All the clinics are already connected. It's a well-organized opportunity for folks to be able to see what resources, where to go for what that's culturally sensitive and accessible.
So you could look at the map and find, this is the one closest to me.
For this need.
Okay. So we have a question here. How do you anticipate bolstering your systems and collaborations with greater cuts to be expected from the present administration? How can the public be more responsive to the growing need? This is the big question.
Something on my radar is that we are, with this administration, very tied to the news cycle. Mm-hmm. And there will be a new emergency in the news cycle. And so, I don't know, maybe pick a news cycle and stick with it. Pick one of the issues that is highlighted and truly follow it. And I feel like the outrage comes and I want to jump to the next thing that I'm outraged about. But maybe if we stuck with it a bit, then we would have more longevity with our impact. That's just one idea.
Any other thoughts on that? What do we do about the...
Yeah, I would say engage with your neighbors, build and deepen your community, the relationships you already have. Take risk if you have privilege, born into it or have access to it. Do more with that. Don't wait for a crisis. Be proactive. Understand the importance of resilience. We all are familiar with the increase of severity and of natural disasters, and the number one indicator of how successful you are in response is your preparedness. So can we begin to support and think more upstream, and how can we be more prepared within ourselves, within our community, within our families, within our communities, and then share those resources and that information so that we are always proactively, strategically ready and engaged and willing to take those risks for our community members who might not have that.
Yeah, I would also say look for like alternative support. Like I mentioned that despite like the federal funding, like we're actively looking for local support, support from the state. So sometimes I think it can be pretty daunting when you're looking at these really large organizations or institutions and you almost feel like you can't find care there, or you don't belong there. That's when I would say like try to find an alternative support space where you feel safe and where you feel included. So like I said, there's like a lot of like organizations that are boots on the ground, some that are still coming up right now. So I would say shift away and try to find alternatives.
Okay. So we have reached the point in our program with time for only one last question. And I sort of went quickly through the audience questions. So I'll ask this of you. You know, the conversation flowed. This was great and very engaging. Is there anything that I didn't bring up that that any of you were hoping to mention this evening, or that you'd just like to reinforce as a takeaway for our audience?
For me, the unhoused neighbors, I think we don't see that many of them in the clinic because we are primary care. We see some. And the amount of wound care, the risk of amputation, the risk of uncontrolled diabetes in our unhoused neighbors is out of control. And so, yes, there's mental health concerns. There are so many things to worry about. And how can we, I hope this room will just hold a spot for unhoused neighbors and the needs that they have physically. And gosh, I don't have a perfect solution, and I apologize because I want to have fun and have solutions for everything, but there is more work to be done there.
And when you talk about a point in the safety net that is failing a bit, that's clearly an area where we need some improvement.
Yeah.
Yeah, I would say we can do better, we should do better, and we should do that in community with each other. So take those calculated risks and do it together in a way that minimizes the harm to those who are impacted. Take that risk, take that harm with your privilege to be able to support our community members who are unhoused, uninsured, undocumented, who are the most vulnerable through, systemic and structural violence. Be aware of those and do what we can without being overwhelmed by it, because it is very overwhelming, as these very smart panelists have shared. And just find that one next thing that you can do that is new and different, that brings you joy, that is hard, but also increases your self-care and the community care. So we can find those synergies, those poly solutions to this poly crisis, and do those more often with the mindfulness, with the intention, then I think we collectively will all benefit.
And Juwan, with all the time people spend on their phones and their devices, is there something that you would, final words of how to perhaps spend that time to help us improve our local healthcare ecosystem?
I mean, just from a technology and fundraising standpoint, I will say if you can, please give to these amazing organizations like the ones the panelists work at. Small organizations often get overlooked because of branding and just awareness and stuff, but like every donation makes such a big difference to the smallest of organizations. And so if you can and you are able, please, just whatever method that you might want to donate to, and if we don't support that yet, tell me please after the talk. I not quite technology related, I'm sorry, but
That's
I will
okay.
just echo what Eric said. I think resources are scarce, and I think coming from a place of abundance, there are so many first-time new donors because of everything that's happening, and I choose to see like the hopeful part of that, of a lot of people deciding to give for the very first time this year, this month. And so if you've been thinking about it, please do so. If you can, please do so. Support these amazing organizations and initiatives.
And Isabel, we'll give you final thoughts or things that you'd like to reinforce about our conversation.
Yeah, so I'm going to go back to building resilience within yourselves. Like my colleagues mentioned, just like stay up to date. I'm sure we all have social media that we would love to get new followers, so shameless plug there. But also, we know within your personal life or within your employment or community or whatever it is, just try to reduce your contribution towards climate change and your contributions to the harmful impacts that it has on like soil or water or air, but also those that are more vulnerable than us.
Great, thank you. So our thanks to our panelists for this stimulating discussion. We also thank you in the audience for your thoughtful questions and for joining us. You are welcome to linger with our panelists just outside the auditorium for complimentary wine and cheese. Now this meeting of the Commonwealth Club of California in its 123rd year of enlightened discussion is adjourned. Members and guests may linger for wine and cheese just outside the Rumby Auditorium. Thank you all.
Thank you.
Thank you, guys.